Hi, good morning, everyone. Welcome to the HR Roundtable. We're going to let everybody file in, and then we'll get started. We will get started soon. Good morning, Alexis. Good morning, Catherine, David Hanley, Greg Myers. Good to see you. Kelly Clark. Morning, Sharon Greenberg. All right. Good morning, everyone. For those who are just logging on right now, welcome to the HR Roundtable. We've got a great panel discussion for you this morning. We're just going to give it a couple of minutes to let people file in, and then we will get started shortly. Great to see everyone. Terry, Stephanie, Shonda. Good morning, Sabrina, Ruth, Ronald, Rebecca, Patricia, Matt Abramowitz. Good morning. Josephine, Jacqueline, Jacinta. Good morning, everyone. Charlotte, good morning. Brandon, good morning. Anna Maria, Alexis. Aisling, great name, great name. All right, welcome everyone to the HR Roundtable. We're going to get started in just a second. We've got a great panel for you this morning, great topic, very important topic. Walter, when we get rolling, actually, I'll be taking over the screen for a hot second there. So I guess when I'm done screen sharing, Walter, you can just kind of take down the screen so we can see all of our people, panelists. That is. Good morning, everyone. We're going to get started in just a minute. Welcome to the HR Roundtable. For those of you who may have received an invitation indirectly, maybe somebody forwarded it to you. If you'd like to be part of our regular distribution and receive invitations directly from the HR Roundtable, a little later on, I will pop my information into the chat window, and you can reach out to me. Just shoot me an email, and we'll make sure to get you on our regular distribution. All right. Well, we are certainly getting there. Pop over here, and I think we can get started. So good morning, everyone. Welcome to the HR Roundtable. My name is Roger Oliver. I'm the Director of Strategic Accounts at the Tempositions Group of Companies. We've been running the HR Roundtable for over 20 years as a way of providing really a useful forum and usable information, critical information to senior HR professionals across all types of businesses, and really to arm people to the teeth with the kind of information and insight that they need, not only to go toe-to-toe with the C-suite when necessary in stating your goals and objectives, but also just to help you in your regular day-to-day work. A little bit about Tempositions, your host for today. We are what I would describe as a multifaceted staffing solutions firm. We provide temporary, temp to hire, and direct hire staffing across a wide range of skill categories. Account Positions is our accounting and finance division. CompuForce for a full range of IT solutions. HR Staffing Solutions is our human resources division. So if you are in need of staff for your team. Contract recruiters are in high demand right now. Well, we can help you in that regard. On-call counsel for legal professionals, attorneys, paralegals, and other legal professionals. School professionals is our education division. We provide substitute teachers for charter schools and private schools. And we are also have the exclusive arrangement with the city to provide pre-K teachers for the universal pre-K program in New York City. So anytime you hear UPK or universal pre-K, that's us. We are the engine under the hood of that program. Our hospitality division, we do provide waiters, bartenders, culinary professionals of all kinds. Occasionally you'll need people for pantry. You know, maybe you're having an event, we can help you with that as well. Temp positions healthcare. We provide nurses, medical professionals, nurse practitioners, medical assistants. We have a large footprint in the social service arena, working with a lot of organizations that provide services to people with developmental disabilities, child welfare, homeless populations, shelter programs like Safe Horizons and WIN. And then on the allied clinical side, we provided and are still staffing the Vaccinate New York initiative for the entire state of New York. So you remember all those large pods at Yankee Stadium and the racetracks and all of those things. Those were all of our people, over 5,000 people. Very proud of that. Our logistics division for light industrial and anything in a warehouse environment. Temp positions are sort of our flagship just for clinical and clinical, for administrative and clerical staffing. I've only had one cup of coffee. This is what happens. Creative Bureau for all things web. And last but not least, our executive search division called TGC Search. All right, well, I'm going to stop sharing now, and I'm going to go ahead and introduce our panel. We've got a great panel for you this morning. We have Dr. Ujwal Ramtekar, who serves as the Senior Medical Director and Enterprise Clinical Strategy at Teladoc Health. He's double-boarded psychiatrist and experienced healthcare executive and a population health expert with numerous scientific publications and presentations focused on telehealth, innovative models of care and mental health, and also passionate about workforce health challenges, including burnout, innovative strategies to mitigate them, and additionally has served on various leadership roles and developed programs in different settings, and continues to participate in community boards focused on advancing mental health. Welcome, Ujwal. We have Dr. Shannon Rocker, and Shannon is a licensed psychologist and Deputy Director of Inpatient Operations for Hutchins Psychiatric Center in Syracuse, New York. She's been with New York State's Office of Mental Health for over 16 years. In addition to her clinical and administrative roles, Dr. Rocker has strong commitment to teaching and mentoring others in the field. She has been an adjunct professor at SUNY Polytech Institute for the past 13 years, and also been invited to present at numerous national and state conferences on a variety of topics in the areas of clinical and forensic work and clinician self-care. We have Dr. Brian Cheng. Brian is the Director of Research of the Global Mental Health Lab at Teachers College of Columbia University. His current research, which focuses on psychometric properties of clinical instruments, as well as the adaptation, training, and evaluation of psychotherapy protocols used by non-specialists in low resource areas, has been supported as a COI in several federal and foundation grants. And Dr. Cheng has collaborated with research, academic, and humanitarian groups as part of treatment studies conducted around the world with various populations. Welcome, Brian. And Dr. Heather Greenwald. Dr. Greenwald brings a unique perspective on corporate consulting, having served as staff psychologist and organizational leader in prisons for over 2 decades. Having sat in dark rooms with the darkest matter discussed, she's found methods to support and inspire and encourage people who have done the worst and bring their best to fruition. And she brings considerable set of skills to organizational consulting. So what brings us here today? I think we have never seen the topic of mental health sort of more centered in society. We have certainly all gone through quite something with the pandemic. We continue to go through it. I think the ripples in the pond are going to be reverberating for years and years to come, and it's going to take maybe a decade for us to really understand what we all went through together. That's sort of the social environment that we're in post-pandemic. Let's hope that it is post. And mental health has just been in everyone's just in sharp focus in our lives. The number of mass shootings that we've had just in the past few days is shocking. I think anyone with school-age kids is familiar with what they have gone through and are still going through with respect to having dealt with the pandemic situation, and that just continues to reverberate with them as well. And then we have the workplace, which is what the focus is today. We've got burnout, and we have other issues. So why don't we just jump into it? As we move forward, if you have questions for the panel, and we encourage questions, please just dive right in. Please put them in the Q&A tab as opposed to the chat window. Use the Q&A tab, and I will do my best to get to as many of your questions that we can answer live here for you as possible. So anyone want to take a stab at burnout and to describe burnout and sort of what we're dealing with? Usual, if maybe you want to take that.
Sure, Roger. Good morning, all. Thanks for joining us. This is really a very relevant topic now more than ever, and there have been various definitions in different contexts of burnout. But in this context, as we're talking about employees and organizations, really burnout is a syndrome that is resulting from a chronic workplace stress that is not successfully managed. So it's not really a me issue for an employee, we issue for an organization. And if we think about the reasons for burnout, it's really sometimes perceived unfairness in treatment of work or unmanageable workload, lack of role clarity, sometimes perceived lack of communication. And again, I'm increasingly using the word perceived because it's really a perception at a personal level. So perceived lack of support from their manageable or unreasonable time pressure. So it's really a bidirectional thing, which is resulting in this sense of detachment, sense of exhaustion from work, and a little bit of sense of cynicism. And all of this collectively is a burnout in a professional sense. Good thing is, even though it has been a topic of discussion for about 20, 30 years, things are being taken really seriously because there are significant impact, not just on personal health, psychological well-being, and overall relationship and productivity. Now there are huge repercussions, even on organizations and employers, where just within the United States, we are losing about $300 billion a year just because of high turnover rate, diminished productivity, huge insurance costs, absenteeism, and retention issues. And now World Health Organization has also recognized and included it in the glossary in the terms of how we describe our mental well-being. So I'll stop there and let my colleagues take it.
Heather, I saw you nodding. Did you want to add?
I thought he was doing a great job.
Okay. Very good. And I guess
I certainly could expand on the theme and just say that in addition to burnout, we're seeing related but different constructs as well that a lot of the HR folks on the line maybe have encountered and have heard about, depending on their field. But that burnout is one of the epidemic aspects we're struggling with, but also vicarious trauma and moral injury or moral distress and compassion fatigue and mental illness. And I know that all of these things are HR concerns. And as HR professionals or line staff supervisors or managers or executives in a C-suite, we don't necessarily know the difference between all of those, and all of those things are happening in the workforce. And the system has to have a process to be sensitive to it and even know they're going on. So just kind of adding to the landscape.
Very good. Shannon, what are the differences between stress and burnout and what you could categorize as mental illness, sort of including the causes, signs, and how employers might approach each case, because I would imagine these are sort of very different things, and not necessarily very easy to parse out, but take a shot.
Well, actually, before we get to that, do you mind if I comment on something that was said a few minutes ago?
Yes, please. By all means, by all means.
So I think one of the biggest contributors to people feeling burned out at work is feeling like they don't have enough time to complete their work, right? They're feeling overwhelmed in their job task. And I think, you were alluding to this a little bit in terms of like the pandemic, right? So especially in mental health care, like, the field that I'm working in a psychiatric hospital, we have a tremendous difficulty right now staffing our facilities. Right. So people who are frontline staff, people who are working their day to day are feeling overwhelmed because we do not have enough staff consistently to complete the work and to provide, the care that we're used to providing. So I think that is contributing to, I don't know if that's the same in other industries. I suspect it is.
I'm sure it is. I mean, friends of mine who've got school-age kids who are dealing with mental health issues. There are not enough professionals there to deal with them. And I'm sure the lack of staff is a huge issue, as well as as people's lack of staff at their workplaces.
Right.
People are experiencing that as well. Brian, do you want to chime in a little bit on burnout?
Yeah, sorry about that. I think everyone else has said it so eloquently. really one of the leading causes. Actually, numerous studies provided strong evidence that burnout does result in absenteeism at work, higher rates of job turnover, as well as creates stigma and reputation for positions and work as well. So it's not only a direct implication to your organization, but reputation goes out. People find out about the type of burnout and stress that your positions or your organizations have, and it prevents people and lowers, recruitment rates and whatnot. And so it is definitely actually a thing that is extremely impactful on your organizational structure. Again, not actually on top of absenteeism, actually also presenteeism. There's a trend now I've been reading a lot about lately called quiet quitting, where people turn up to work, they work, but they do the absolute bare minimum and sometimes not even there, but without cause for needing to leave. And so, all these things are essentially mostly affected by burnout.
Sure. And we've got one of our, we got a question in the tab asking, I think this is for you, Yujwal. So it would be great if you could restate his definition of burnout in the workplace. So do you have sort of a concise way of defining burnout in the workplace? How would you describe?
Sure. I think burnout really is a syndrome which is resulting from chronic workplace stress that has not been successfully managed. And this is purely in the context of workplace. And just to expand on that, we would say stress is just a physiological or human psychological reaction to things that are called stressors. Mm-hmm. And the stressors could be related to work, but the stressors could also be related to workplace. And stressors could be related to really trying to manage and juggle things, particularly in the context of pandemic, between work, home life, parenting, caregiving to elders, and our own self-care as well. And so I wanted to really a little bit expand on that because Roger, you said something really interesting, in response to Dr. Shannon's very astute remark that the professions that are really mission-driven and that are really about some giving type, so healthcare, social work, HR professions are always looking for well-being for their employees, etc. They are also at a little bit higher risk of burnout as well. And Dr. Greenwald had called it as compassion fatigue, which was great. Mm-hmm. But one thing to really mention on your comment, Roger, when you said one of your colleagues who has a child struggling with mental health issues has been really struggling because there are not enough providers out there. A subtle thing that I noticed there is, look, even if it's an employee, if you think about it from an employee perspective, that in itself, the family issue, the child struggling with mental health concerns or a family member having some needs is a direct stressor that is then contributing to the burnout because it's now showing up at work and showing up at probably at their performance as well. So even though we try to define it more in the context of workplace, we also have to think about it more in the context of a whole context that work is part of their overall life, but so is family, so is self, so is their social circle and other responsibilities as well.
Sure. Shannon, do you want to add to that? I saw you nodding.
I couldn't, he was breaking up a little bit on my end, so okay. I couldn't hear everything.
Yeah, I think.
No, I agree. I think that again, go ahead.
No, I was going to say I've got you breaking up a little bit, so we've got maybe have a little bit of signal issues today, but that's fairly typical. We'll just roll with it. But go ahead. I think we can hear you. Go ahead, Shannon.
No, I think exactly. I think the home, the societal, the family issues. So he's saying contributing to the workplace stress as well, and so that's a significant issue that that employers need to.
Okay. Yeah, you're breaking up a bit. If it continues, maybe sometimes turning your camera off for a minute will help the signal be stronger there. So back to where we were for a moment earlier, and sort of talking about the difference between stress and burnout. These kind of the pressure cooker that people are in, and how that differs from differs from mental illness, or do you see those as two separate things? Brian, do you want to take a shot at that?
Sure, I'll try. Like Dr. Rampakar mentioned, burnout is a syndrome that is caused by stress, right? So stress is the cause. Burnout is the effect that we see, particularly the workplace. But again, like you mentioned, you can feel burnout as a parent, feel burnout as a caregiver. It's not particularly to workplace, but workplace burnout is now increasingly looked at, caused by not just stress at the workplace that is not managed effectively, but also stress from life, right? Outside, all the other aspects of a person's complex life, contributing to, feeling burnout even at the workplace. Mental illness is related in the sense that, it can contribute to stress and burnout. And also the other way around, it's bidirectional. Stress and burnout can also contribute to a higher chance or high risk of mental illness. But it is essentially a distinct concept or construct, because mental illness has multiple factors and multiple causes that may, cause someone to feel depressed or to develop anxiety over time, right? Or it could be something that has been chronic and has been developing since childhood or adolescent, right? We have childhood and adolescent disorders that go into adulthood. So it is related, it is associated, but definitely still distinct. And actually, in the world nowadays, with research with the World Health Organization, we're really also moving a little bit away from the term mental illness. We're using mental health conditions. It's much more inclusive, much more comprehensive, right? Because if we think of physical health, one could have a physical health condition, but it's not necessarily an illness just yet, right? One could be pre-diabetic, but not diabetic. And so thinking of the same way, right? A lot of people, especially given the pandemic and how things are going, may be experiencing mental health conditions, although it may not turn into a full-blown mental disorder or mental illness.
All right, that's very, very good point. So how does someone from an HR or workplace or a manager's position, I guess that, listening to everyone here and discussing burnout, it seems as if burnout is something that could probably be addressed, maybe not entirely alleviated, but certainly addressed in a way from an employer's standpoint to give some relief to a situation, or potentially offer some relief there. Whereas something that is a mental health condition is obviously something a little bit more complex and a little bit outside of the the wheelhouse of that person. What are some of the ways that Shannon, I can throw this to you, some of the ways that an employer might look to help alleviate or address some of that burnout? And then what would that employer do? How might they approach a situation where that was a little bit more pronounced than that, something that we would call a mental health condition?
So that's a big question.
Yeah, I think you would break it up into smaller pieces. Maybe you can take the first half and
Right. So I think that a lot of the way we might address it would be individualized, right? And so I think we need to talk to the employees and figure out what their particular needs are, because I think sometimes as employers or as HR professionals, we assume what our employees need, and that may not actually be what they need.
Mhm.
So we may be focused on medications or prescriptions or things like that. And our employees may be focused on, I'm not getting enough sleep. I don't get enough physical activity. I may need help in those areas.
Mhm.
And so I think having a more personalized approach is important. So making sure that we're talking to people about those things is, in my opinion, very important. I don't know if the other panelists would agree or have other thoughts on that.
Can I jump in there as well?
Sure.
I also think it's important to remember that, as our colleagues just said, it's burnout is cumulative, and burnout is also perceived. It's perceived workload, and it is perceived exhaustion. And so, because perception can change, that is the opportunity point, right, in both. So first, does management even think their people should be burnt out? Sometimes management thinks, hey, this workload's not overwhelming. And yet at the shop floor or the virtual office, people feel overwhelmed. And so there's also sometimes a disconnect. So the talking to the employee is super important, you know, as Dr. Rocker just said, because that perception is what is creating the burnout. And sometimes it's reality. There's just too much work and there's no way for it to be done. And sometimes it is a conversation could change everything and undo those tiny little paper cuts that made it cumulative. So the engagement is a huge part first. But in addition to engagement is, does the system have a system of routine maintenance for its employees to say when they're overwhelmed, or if they can foresee, if you roll out this new initiative, we're going to get overwhelmed. So we don't always want it to be responsive or reactionary either. We also want to be preventative in rollouts and in initiatives and in new policies and changes. And when people are leaving in this time of high turnover, we also want to anticipate this unit that's now left with less and less people. We can anticipate they're going to get burnout. And what do you do, especially when it's also happening within the HR unit that's trying to hire people just as fast to plug them back into those holes? And I wouldn't doubt that some of the HR folks on this call also are experiencing that, and to hold that.
I'm sure that's true. What would you say in terms of just approach for how would you suggest an HR professional or a manager approach an employee if an employee is not necessarily reaching out for help? It's a very sensitive topic. Does anyone have any sort of best practices, rules of thumb? And if not the best course of action, maybe something that is not not the way to approach something. So do's and don'ts. Anyone want to take that? Brian, you want to?
Sure. I was gonna, thanks, Dr. Greenwald, for putting it so eloquently. Again, all the other colleagues here have mentioned and kind of framed it that way. The way I think of it, kind of in addition to what Dr. Greenwald said, is really the question you just posed, Roger. It requires a twin track approach, right? So in trying to manage burnout, you need to have both a preventive intervention and an abortive intervention, right? So what you mentioned is actually, when an employee feels like they cannot come to an HR professional or to their direct supervisor to talk about burnout and their perceived stress, their perceived increased workload, their feelings of being overwhelmed, then that is something that needs to be tackled in a preventive intervention, right? And part of creating a preventive intervention is to make sure you include elements of creating, a healthier workplace dynamic, of creating a setting, an environment that encourages people and lets your employees know that this is something that you could come and approach because we are open to hear. We want to make sure that we help you be as optimal as you can in terms of your workplace experience and environment. So that comes as part of the preventive piece, right? A preventive intervention where you have things, policies, and practices in place. And it sounds like, if it does get to that point and they don't come to you, then we're looking at an abortive intervention here. So how do you currently reduce burnout? And like Dr. Greenwald mentioned, a lot of the time it's actually providing some options to them. So, not necessarily going to the person and say, let's talk about how you're doing because I notice you're feeling burnout, but actually letting know that there are options and that you can talk to me, right? One thing I think is a huge scary situation is burnout is stigmatized, and employees may be afraid. And I can speak for myself as an employee of a huge, right, educational organization. I may feel burnout, but I may feel that I cannot let my supervisor know if I do experience burnout because I don't want to be perceived as being less effective and have my position replaced or have responsibilities taken away from my plate, which are essentially what I find gratifying about my job, right? And so to not necessarily force the person to talk about their burnout or what you think they may be experiencing as burnout, but to say that we're here, I'm here, should you want to talk? And again, there's no judgment in these conversations.
Mm-hmm. Yeah, it's very interesting. They, you mentioned stigma, and I think it's really sort of amazing how the landscape has changed, to a great extent, and in the public sphere when it comes to discussions of mental health, whether they are athletes, celebrities, actors, actresses who have been very open about pulling back from their work, pulling back from projects, pulling back from the public eye in order to focus on their mental health. And our Michael Phelps, who's on doing ads for therapeutic services and talking about what a positive thing that's been in his life, and sort of trying to I guess normalize the conversation, normalize the discussion, and yet when it comes down to the workplace, when it comes down to the nitty-gritty, what's right in front of people, I would imagine that stigma is still huge, and something that people want to avoid. They want to shy away from it. They don't want to be labeled. And even in really high pressure jobs, I've heard certainly people in the military, police officers, healthcare professionals, people who I think folks would expect to be burned out, who folks would expect to be highly susceptible to mental challenges, they don't want to go there. So is there anything that that we can kind of share with our HR audience about what does that openness look like? What does that letting people know that that it's okay? Is there anything that anyone would like to share as to how do you go about that, knowing that the hesitancy is still there, and that the stigma still looms large? Anyone? want to, Shannon?
I was just going to say there's, I like the point that you make about the professional athletes and the celebrities who have been working to make it less of a stigma to talk about mental health issues. I do know I have a good friend whose son is in the NFL, and his big movement right now is to talk about anxiety disorders and things like that. And he has really been promoting kind of his messages. It's okay not to be okay. And I think that is huge. And I think, talking to kids about that, but I think HR professionals can use that and, making sure that people do know it's okay not to be okay.
Mhm.
And if I may add to that, I think you put it so nicely, Dr. Rucker. This kind of goes in line a little bit with one of the questions on the Q&A panel, I think from David Henley. Things such as employee assistance could work. I think it's a very useful thing if you can start from the get-go when someone's being hired, through the hiring process, during the onboarding, when they're looking at their benefits, to make sure that there's a strong encouragement and mention of services and resources in place that can help with prevent burnout, but also help with mental health, right, and improve mental well-being. I can say for myself personally, as an employee of Columbia, I was very surprised when I started with them that they do have kind of the separate initiative. On top of your benefits, you also can approach these panel of psychologists or psychiatrists, even though I'm a psychologist myself, to process things and to work on your mental health. And this is how much we would compensate for that. And to actually de-link, right, the organization from someone's mental health. And this is not someone that works for Columbia. They don't come back to tell us how you're doing. This is for your own health and mental well-being. And hopefully you would feel better if you do choose to use this, and we do encourage you to use this service, right? So employee assistance is one thing, but there's also a lot of stigma and fear because it's tied to the organization, right? There's a fear of the repercussions, there's a fear of punishment, penalties, because what if I tell this person what I truly feel about my supervisor? Does it get back to them? So it's important to have this external, but not link where there's no direct feedback, right? I think one of the most powerful things that can happen is when an employee learns through their own therapy or whatever it is that they go to, and they get, the resources they need, that they feel empowered then to come back and actually have frank conversations with their direct, supervisors and reports.
All right, let's take a few of these other questions here.
Can I respond to a couple?
Yes, please, but read the question out loud before
Okay. First of all, I think two of them can go together here. So how about when employees are nervous to reach out to employee assistance program? Since Byron's just speaking about that, I feel one of the concerns, wrote the attendee, is worrying that it may not be 100% confidential and that this is communicated multiple times, but that the engagement rate remains low. So what is the recommendation to promote it and encourage employees to use it? And that really goes to what everyone on the panel is talking about right now, because if there's a stigma, then, oh gosh, if I do this, somebody's going to know and it's going to affect my career or their perception of me. So how do we get people to use the services, whether it's EAP or some other access point, some other great program that you provide? How do you get people to do it? And we were just talking about celebrities touting new care points or new awarenesses of mental illness. And so within a corporate culture, who are the celebrities there, but people that work there, right? So talking about it amongst management levels, amongst staffing. So within meetings, talking about, hey, this is part of like an oil change for your car. It doesn't mean the car is not going to perform at a high level. In fact, your car is going to perform at a much better level if you get an oil change on time. And that these things that we can do for ourselves and for each other, they're the oil changes for our high performance vehicles. And to be thinking of it as we are a system that needs care, maintenance, prevention. and really normalizing that in the corporate culture by communicating it. In terms of EAP, the other way to normalize that and get people to do it more is have EAP come for wellness and health things, not just disease and dysfunction and distress and acute things. So don't only have EAP come for functions when someone's committed suicide, or, hey, you all are being unproductive, let's get EAP in here to come see how you're all doing. Have EAP engagement for preventative things and wellness things and health related things, so that people see themselves and the system as this is part of my normal, as well as when I go into a distressed point. So
yeah, I love the oil change analogy. I think that's fantastic. Maintenance, regularly scheduled maintenance. Very good. How about let's take these other two questions here. So Greg asks how to get executives to believe there's burnout and stress in the workplace. I think many do not understand that there is any in the workplace. We know it in HR, but they generally do not. So how about communicating that? Brian, you want to take a stab at that?
Sure. My guess is, I don't work in corporate, but I guess it's still similar with leadership, right? Numbers speak the most to them. So showing data and evidence, which I'm assuming usually you would have, right? So cumulative reports and numbers about overall productivity of a division, right? But not to pinpoint direct and specific people, but to talk as an aggregate. This is what productivity levels have. So showing those numbers, and then backing that up with data that is generated from research, right? Strong evidence, international research that has been done in numerous first world countries, developed countries, high, GDP countries have shown that that burnout does exist, and it exists in anywhere between, in the lower end, 15 to 20%, in some Scandinavian countries, great settings and environments to work there, to the States and the UK, Australia, where it's as high as 40% of the workforce within any organization at any given time. So all these data exist out there, right? Research have been done. And a lot of good research has also shown that by preventing burnout and also treating it as it is existent in the workplace right now, actually there's a high return on investment. Several great studies, actually, the World Bank has published a few together with the WHO that shows on average, and for every dollar an organization, a system, a region, or even a country invests in mental health and mental well-being, it's an average of $3 to $4 back, right? So this is shown numerically in terms of return on investment, of cost, and what you get back as an organization. So there's strong evidence for preventing and intervening in burnout.
All right.
And they might just have to be made aware of it.
Great. So we got a poll question here. What percentage of workers have experienced workplace burnout and stress? And I guess this is really, this is a test question. Isn't that right, Walter? This is really about, your guess for what, societally is the percentage of workers who've experienced, workplace stress and burnout. What would you think that number would be? And see the results of that poll in a moment. In the meantime, let's move over to a question from Sonia. She says, as mentioned in healthcare, in the healthcare industry, there's more legislation conversation in place around appropriate staff ratios to properly service their populations. Oh, here we go. Most people voted 75 there. Walter, do we have a correct answer to that?
I think Ujwal could comment on that.
Yeah, that is correct. So 50%
Yeah.
of the audience are absolutely right.
All right. As I was saying, Sony says, as mentioned in healthcare industry, there's more legislation and conversation in place around appropriate staff ratios to properly service their populations. Are there any updates or new information across industries on what updated info there might be around appropriate ratios regarding HR support of their populations, or what framework you might use to best determine a good ratio for HR support for their particular organizational structure? Anyone want to take a stab at that? Anyone know of any way that our current thinking or with regard to ratios, or anyone out there in the audience, if you want to pop that into the chat window here, if you've got any information on that regarding ratios, the same way as you have in a healthcare environment. Anyone have any thoughts on that particular question as to whether or not have you seen any way that HR ratios, sort of staff to HR ratios, are have been addressed or recalculated? I can't say that I have.
I don't have a ratio answer, but I wanted to speak to the spirit of the question and just say that, like another question that we had, it says, like, how do we even know that when management doesn't even think there is a workload issue? One of our other questions was saying management doesn't even think there is a workload issue, and HR is saying, hey, we're not mental health professionals, and we don't even have enough people to be dealing and absorbing all of the stress and issues that are out there, and we can't differentiate between stress that's good for you and stress that's debilitating to you, and then mental illness. And that's what we're seeing as a theme through some of these questions. And another one of our people is saying here, hey, we can't even stop the rollout of all of this workload coming at our people, as Catherine writes here in the question.
Mhm.
And so when we're talking about, well, what's a good ratio? It's really, are we spending any money on this at all? We have dashboards and metrics for every single little thing in productivity, right? We have quality indicators and quantity indicators, and we drill down to the nth degree on all of those. But we don't have health dashboards on our employees typically, unless we've already spent some money on it. We don't have a wellness index for our employees. We don't have are they using their vacation? Are they taking it planned and coming back rejuvenated? We're not looking at metrics there. And what the new zeitgeist is kind of telling us is we have to. With 75% of people burn out, it's time to have a kind of wellness response and spend some money on wellness. And when we're wanting to have an event to help burnout, it's also really important to not forget the positives. If you have a health fair and it's all about diseases, we're not promoting health. We're talking about diseases, which is important. And we want to hold the whole person. So putting money and talking to management about getting some funding to have consultants come in or have an internal team work on, doesn't always have to be from the outside, but some money, some funding, some attention does need to get spent on it. And that takes persuading the C-suite.
Sure. Yeah. And Catherine's full question for the rest of you was, she said sometimes the workload and rollout of new initiatives is outside of the control of employers. In the case of contracted programs where targets don't change, even if the staffing levels have. There's another question here: how to deal with rejection as a result of knowing that you are burned out. And how do you regain your mojo? Anyone want to sort of address that? I mean, no one should be having to deal with rejection as a and I guess it's asking of people knowing that you are burned out, or maybe yourself knowing that you're burned out. How do you get yourself back and to a state of fitness and or as I said, no one should have to deal with with rejection as a result of being burnt out, feeling burnt out, expressing to someone that you're feeling burned out. I guess we're talking about some of the things that we mentioned earlier in terms of sleep and exercise. Anyone want to dive in? Shannon, you want to take a stab at that?
Oh, I thought someone else was jumping in. No, I think that
Go ahead.
I think it's, again, individual. I think we all have ways of kind of regrouping and getting back to, our baseline, whether it's walking, taking long walks. I know for me during the pandemic, that was a huge thing, right? It was just the ability to clear my head, I think that normalizing the fact that we do get burned out, right? And then it's, again, okay to not be okay. So I think, again, it's going to be individual, trying to figure out what exactly is the source of the burnout. Is it lack, like you were saying, is it lack of sleep? Is it the workload? Do I need to figure out strategies to figure out how to manage my workload? Or is it like home related stuff? So I think looking at those things can help.
I would agree with Dr. Rocker there. It's very individualized. First of all, one should definitely recognize that, again, it's not a me issue, it's a us issue in work contributing to that burnout and sense of burnout. So they should obviously appropriately seek out any resources that are available through workplace, because a lot of times there are resources available that just don't know about it, or it's not easy to access. And so it's really the responsibility of sharing this or accessing it is shifted just from an employee to an organization in a very systematic way. But regarding the personal self thing, I think understanding what the potential reasons are, and we talked about earlier what are several factors of those burnout, particularly the work-life balance issue is an important thing. These days we are seeing a lot of work from home, and oftentimes that leads to a little bit of increase several of the employees as well. We used to say, I want to leave work at the door. Well, there's no door anymore. You're in there. So you find yourself working 30% more. There's no detachment or transition from work mode to home mode. So being mindful about this is my structured work time and this is my structured home time is very important. And then there are some I wouldn't say self-help, but some of the things that you can do yourself, including the mindfulness, resilience, exercise, sleep, understanding that this chronic stress is not just about mental health and mental being. It has very direct, measurable impact on your physical health. So your diabetes, your hypertension are going to get worse. As an employer, the workers' comp and the medical bills for your employees who are burned out are going to be higher, even if it's not related to mental health related spend. It's really about their other healthcare spend. And then learning about the fact that you're not alone, and there are these peer coaches which the organizations can support, because anytime there is some concern, who do people go to? They go to the people they trust more often than not at their workplace community, their trusted mentors. And so, for example, at Teladoc Health, we have something called as business resources around different topics. One is about nurture, which is how do you bring yourself fully at work when you are a caregiver of elderly parents and a parent to younger children? And how do we deal with some of the stresses and struggles? So creating a safe space where you feel that you're not alone, an organization supports it, it's great. And then going back to the very initial piece, Roger, that we had asked about stress and burnout and mental illness, it's really a continuum, it's really a spectrum. And so sometimes we just need to be proactive rather than reactive. And not everybody who is struggling with stress or a little bit of burnout needs to have full therapy or psychiatry. Other things that could be done that could be done through some peer guidance, peer coaching, or coaching. There are many other things that are very subclinical, but could be preventative, that could be done in a very digital way. And so the fortunate thing with COVID has been the widespread adoption and a lot of embracement and acceptance to virtual care solutions, for example, which provides digital tools that you can access while you're on your work desk on your phone, do a little bit of mindfulness that could teach you some skills or go through the full programs, or you could talk to a coach during your lunch break without really having to take time off and going somewhere. And then do it in a way that is trusted, confidential, and extremely accessible, that does not really up and adds to the burnout for trying to carve out time to go for therapy, psychiatry, or coaching. They all could be done through virtual care full spectrum suites as well. So a lot of resources out there.
Yeah, I saw someone asking sort of a question we've covered in a way is how to get management to buy in, to allow time for wellness events and things like that. I think what you're saying about the workers' comp and insurance, that's a good way to get management and the C-suite to pay attention to the increased costs and some of those effects on their bottom line when it comes to the effects of stress and burnout. All right, so we have a question up here, a test question. What is the collective cost of work stress and burnout to U.S. employers? How big is that figure? Go ahead and throw your answers up there, and then we'll have an answer to that. Norma asks, does anyone have a book about burnout that they would recommend? Has anyone read any good books on burnout that? If we don't have any answers, then I think you guys need to write one. You guys have no one can think of a best-selling book on burnout. I think there's an opportunity here.
I think I'd suggest that they read one that would promote like positive psychology, a gratitude. There's great books on gratitude lessons or mindfulness. So like reading The Antidote maybe would be a great practice for somebody that is burnout, in addition to getting information, which there's tons online. But I don't have a good book for burnout, but I guess I would do my homework.
Joe Posner put something here in the Q&A here. Walter, can you pop that into the chat window so everyone can see it? There's a book on, thank you, Joe, for that, managing employee burnout. All right, so there's a book, Ask and You Shall Receive.
Yeah, not really a book, but I'm a big fan of HBR guides, the Harvard Business Review guides. There is a very good collection of several articles on burnout and burnout prevention that has been written with organizations in mind rather than person or employee in mind. So that might be a good potential resource as well.
All right, so the most people guessed 150 billion is the collective cost of work stress and burnout. What is the actual answer to that question? Do we have a?
I think it's 300 billion.
And actually growing since coming out of the pandemic.
And if you think about globally, it's about 1 trillion within a year. And as Brian said, it's growing, and it's not just from the productivity, absenteeism, and overall business impact on the organizations, but also the stress on the healthcare system. And again, indirectly on the businesses, because that is now constituting to about 8% of total healthcare spend, which employers are sometimes responsible for. And on a very personal and society level, we're looking at somewhere between 100,000 to 150,000 deaths. I'm not talking disability, deaths as a direct impact of burnout-related consequences. So it's not just lost revenue and finances, it's also lost lives, which makes it really an important topic to tackle.
All right, we have a question here, sort of along the lines of whether or not burnout is contagious. Is there any research on long-term effects of burnout from one employee, burnout from a current employee, sort of carrying over to a new employee? Anyone want to respond to that? I don't know if we have research on it, but anyone want to sort of talk about how does sort of like secondhand smoke here? How does burnout in one individual affect another in the workplace environment? Brian, you want to?
Sure. I was going to say, I don't know if there's research done. Actually, it's quite interesting. So I'm actually going to do some homework right after this, because I would like to know if there's research done on the contagion effect of burnout. We do know, though, from research, it's quite established at this point that there is contagion effects of mental health conditions. So depression can spread, anxiety can spread, and through numerous mechanisms in the workplace, in communities, in families. And so I would, surmise that it would be the same with burnout. I mean, because if we think of it, if someone comes in and is a new recruit, a new employee, and they observe, right? It's tangible and observable when someone else on their team is experiencing burnout and exhibiting signs of workplace distress, right, and possibly developing a mental health condition. It changes how they view their position, the responsibilities they have, the expectations that that the organization has about them, and it also probably skews their idea of what they can bring and how much do they actually have to contribute. Right. And then that can just, becomes one of the stressors and contributors to their own burnout. So I do think that it's very much contagious in that sense.
Yeah, I agree with Brian there, and I would expand on that. Because we're talking about burnout as a response to chronic work stress that is not properly managed. And so the stemming problem at the basis of, which is the basis of burnout, is going to be the same for various folks. And that's where some of that intelligent questioning and data comes out. Because often we're not able to see the hidden burnout. You're looking at dashboards. Some of the most burnt out folks, who are kind of sometimes type A employees, are some of the most productive, and also would be rating themselves as highly engaged, but they are the ones who suddenly go down the cliff from this burnout. And often the issues are the same. So asking a question that is inclusive and non-biased and non-judgmental and really not even related directly to burnout is also helpful. For example,
can you give us any examples of that?
Sure. Yeah, like good question was, what is most frustrating for you at work right now? You're not talking about burnout, what's most causing burnout. We're saying, what is most frustrating for you at work? And in our hospital, it was the non-functional in the back office. So everybody had to run at the front desk to even do simple things like prescriptions or writing a letter of excuse because they came for appointment or other things, simple things. Or suddenly coffee machine in the break room is not working, or water machine is not working, and now people have to go all the way to the cafeteria to do that. Or in virtual cases, getting an email from your boss at 10 p.m. with not so subtle expectation of responding. Well, if we say, don't send me an email, that is a great thing. Or asking questions about, have you taken all of your allotted vacation time this year? Or even making it one of in the performance reviews or typical one-on-ones to say, have you taken all of your allotted time that was for your PTO or for your vacation? And if not, talking about it and asking them about, hey, is it because you're feeling that you cannot disconnect and you have a lot of work to do that you cannot manage, and that's why you're really trying to use all of this time and not unplugging? Those are some of the good inclusive questions that could provide a good indication of burnout that is hidden, that is not obviously there as well.
All right. Does anyone have any sort of anecdotes that they would want to share about a workplace mental health issue that you think was handled particularly well, or one that you've either became aware of or were involved in somehow that was handled poorly? And I will take either versions. So anyone want to jump in with a story of well handled or poorly handled?
I can speak to something that's well handled, I guess.
Okay.
It's actually a personal story of mine. And I know this is kind of what's been affecting millions of employees. It's, when a lot of, especially in healthcare, when we transitioned to telework, right, during the pandemic, and now coming out of it, this expectation of being available at all times during the day is one of the biggest, I think, contributors to burnout, right? Whereas previously, pre-pandemic, it's a 9 to 5, sometimes in healthcare for us, maybe 8:30 to 6:30, that's normal. But there was this, compartmentalization, right? There's some work-life balance where you could, when you leave work, and I leave my patients behind, I leave my research behind, I leave my reports behind, and spend whatever evening I have for other things. However, because of telework now, right, because of remote working, your days are more diffuse, but it becomes longer, like Dr. Ramdekar said, getting an email from your supervisor at 10 is not uncommon, and with this subtle expectation of responding, even though it's not explicitly mentioned. And personally, I experienced a lot of burnout, being in healthcare and education myself. And I noticed myself, thankfully, I have the wherewithal and awareness, being a psychologist myself, but I noticed myself developing a lot of anxiety about work. The next day, oh my God, I have so much to do, and depression. And actually that significantly, caused me to have low numbers in my reports and my grant management and whatnot at work. And so thankfully I have a direct report, a supervisor who was very, very much an advocate of mental well-being and prevention of burnout. And we, she had to sit me down, and we got management in as well to talk about, look, maybe we should, even though we're doing remote work, at that point, we should actually instate a no emails after 6:30 p.m. And even though I was clinically depressed and probably developing some levels of close to clinical anxiety, an intervention as simple as that actually aided me tremendously, right? Knowing that I can leave at 6:30, shut my work computer down, and go on with my life, with my family, my dog. That was itself preventive for what could have been full-blown mental illness. Just an example of something very small like that.
Sure.
That can be preventive of burnout.
That's tremendous. That's tremendous.
Yeah, Roger,
Um,
I will give an example of organ and a very intentional thing that could be helpful that we experienced recently. One of the key things, and Brian mentioned it really nicely as well, that there's always this need to do something in this. There's a whole busyness paradox right now going on, where we want to do it all, but we can't have it all, and there's not always available resources. The issue is we really are not good at properly measuring the productivity of knowledge workers, like researchers, like psychologists, like healthcare providers, like HR professionals. Generally, it takes about 3 hours of uninterrupted time to really reflect upon, plan, engage, and do some meaningful work. Because otherwise, you and I, and I'm pretty sure that all of our attendees today can really relate to this fact that you start your work, you're plowing through emails, you're putting off fires, you're in a bunch of meetings. And by the time it's 5:30 or 6, you just have this great grand realization that dawns on you that, man, I did not do anything that I needed to do. And I was very busy, but not productive. And that is causing a lot of stress. What our company at Teladoc Health did several months ago is they implemented not only just the meeting hygienes to say there are no back-to-back meetings. It's never a 30-minute meeting. It's a 25-minute meeting. It's never a 1-hour meeting. There's a 50 so that people can decompress, people can really transition. Otherwise, when we are working remotely and everything is online, things could be really back-to-back, and that's not appropriate. In addition to really good meeting hygiene that has been supported, trained appropriately, had advertised, another thing that was happening is now we get a blocked chunk called Focus Forward of 4 hours a week, where it's blocked. There could be no meeting, there could be nothing. It's not negotiable. That it's all just purely for you to focus and work on. And that really aligns with what knowledge workers generally need. This is really an example of organization-wide effort to support and prevent burnout. And on a personal level, we have been having these discussions. For example, we have continuous and free access, because it's internal, to our wonderful solution for mental health, because it's not just about mental health as in therapy and psychiatry. We also have guidance and coaching, and we have about 1,100 different digital programs that really we can access with trust and confidentiality, because it's not internal. Even though it's offered by us as the Teladoc Health mental health solution, it is something that we can access free of cost, anytime, and unlimited. That having that resource at the back of you, literally of your phone in your pocket, is a huge, huge, huge stress reliever and burnout prevention for our workforce as well.
Terrific. Here we have a poll question here, and this is just for everyone here. Are you planning to provide or expand engagement around burnout and mental health in your company? And multiple choice here. So let's see what people are doing and plan to be doing. And again, I just wanted to repeat, as I had mentioned earlier, I think I should be able to put this in the chat window, or actually, Walter, if you can help me out and pop this in so that everyone can see it. If you received your invite to the HR roundtable indirectly, maybe somebody forwarded it to you, or maybe you saw it on LinkedIn, and you would like to be receive invitations to upcoming HR roundtables to be part of our forum. We try to do them on a monthly basis. I would love to have you. Just pop to my contact information in the chat window. Just shoot me an email, and I will make sure that you are on our regular distribution list. We still have time for a few more questions if you guys want to Ask away. You got the panel.
Roger, can I add something?
Yes, please do.
I was just gonna say, yeah, no, we talked a little bit about EAP, and I think, companies use EAP in different ways. I would just like to also say that I think it's important that companies have other, I don't know, organizations or committees that maybe contribute to a culture of wellness. So like we have employee wellness committees that just focus on, promoting and doing wellness activities, whether they're athletic activities or weight loss or, doing a walkathon, those kinds of things. We also have employee recognition committees. So really, that are volunteers in the organization who just recognize peers, right? And so then we make a big production out of that, and people get, talk about the good work that their peers do, and that gets posted in the newsletter. So kind of promoting people from within, I think, is also very important. So it doesn't just have to come from, HR or up above. So I think promoting that culture from within the company is important.
That's great advice.
Just wanted to add to that, actually, there's great evidence about, sorry, I keep talking about evidence, a researcher at heart here, as you can see from my job. But there's actually a good amount of evidence showing that some of the most effective interventions and strategies within organizational culture is to have champions, right? In my line of work, we always use champions to advocate, right? So it's peers, it's not upper management or leadership, right? We're talking about middle to low middle management. We're talking about peers to champion these initiatives, and those usually get the most buy-in.
And bringing in, I think with a piece that's happening in some of those solutions where we're focused on wellness is bringing pleasurable activities to the workplace and to work life, in addition to reminding folks to also carry that over into their personal lives, to remember to have fun, to remember to have some pleasure in life. And then the other thing that gets lost in modern work life is meaning. With all of this busyness, as our colleagues were speaking to, we're busy, and the thing that we care about, that work piece that we want to be doing and that keeps getting interrupted, the meaning sometimes gets lost. And so the uninterrupted time, I just loved what you were saying about having that uninterrupted time and the meeting hygiene, because it's so important. And also letting staff and managers carve out a specific amount of time in their schedules. Some organizations are making it 5%, 10%, 25%, that even if the roof feels like it's falling in on us, we have to carve out this time because it's why we came here. It's why we felt like we were working toward a vision. And it's the thing that gets us through the stress, that changes the perception, that makes it not burnout. We can work so hard for so long if we feel like something is being accomplished, that we feel like we're part of something that is good and that we want to be doing. We can handle more stress than we can actually handle right now if we're not feeling good about it. If it doesn't feel pleasant, if we don't feel like we're part of a team or want to be part of a team or like the people on the team anymore, because we only just fight now and compete over the very minor resources that we feel like are left. You took the ink and you got the good coffee maker. And so bringing back meaning and pleasant experiences with one another, it's so important. So some companies are even putting in creativity time that you block on your schedule and saying 5% of your time, you block it out and call it your creative passion time and work on something, anything you want that we didn't even ask you to work on in this company, and then present it to us. So little things like that also can help.
Yeah. Roger, can I add to Dr.
Yeah, please.
Thing? And tying it back to the topic today, burnout and the definition. We had number one, sense of exhaustion, right? Busyness. Number two was really this sense of negativity, cynicism. And third is feeling like we don't have professional efficacy. I love what Dr. Greenwald said about sense of purpose or meaning that really goes towards the professional efficacy piece, really drives a lot of engagement. And I'll say, now that a lot of workforce is you're going to deal with as HR professionals with a lot of millennials like us, boredom, man, is the kryptonite for this millennial generation of workers. We need to keep them engaged way by communicating every now and then consistently about how their work, their day-to-day work is connected and contributing to the larger organizational mission. Why are they there and how their piece is one piece of the puzzle, but it's an important and crucial piece for this big organizational picture that is bringing some change to the lives of their clients, customers, or patients in healthcare as well. And so burnout by definition has to have impact on all three domains that I said. Just one domain is not technically considered burnout, but in all three domains. And by doing these things, and as Dr. Greenwald beautifully said, some of these things can really tackle at least two of the three domains, and we can work on work-life balance piece, and that could be a very nice, good solution for burnout. Because parting thought really could be here. It's not doom and gloom. Burnout is preventable. Burnout is unseen, but can be seen with data. And so all it needs is a little bit of organizational commitment to offer, ask, and follow through. Not just offer, but make sure that people are able to access it. We are able to follow through on it. And they are getting anything that's in a timely manner, in the most personalized and meaningful way, and not just one size fits all way.
Right. Sounds terrific. Thank you all so much. Ujwal Ramtekar, Shannon Rocker, Heather Greenwald, Brian Chang, we thank you so much. This has been tremendous. All of you, the video of this will be made available to you. We're also going to include the contact information for everyone here on the panel so that you're able to reach out to them directly with questions or engage them in any way for your own organizations as well. As you know, SHRM credits will be available for having joined us and viewed this. And we look forward to seeing you all for the next HR roundtable, and you will receive an invite in the by regular means. And anyone who is not on the list, just email me, and I will get that to you. Again, thanks so much to the panel. This has been terrific. Everyone get out there and have a fantastic rest of your day, and take some of this great advice that you've heard into to use for yourself, for your family, for those around you, and also to bring into your organizations as well. Here we go. Walter, take us out, sir. This is the longest fade out in history here. I think Walter got tied out.